every once in a while, like I will talk to a congressperson's office. I can't say that I've ever talked to a congressperson, but the people in their office and related to PCORI. And one of the things that they say is that they need research to inform their policy making. So you were saying before, which I've already forgotten except for the suicidality thread, is so what do you think are in this young adult and mental health portfolio? What is there that will help policymakers?
Sure. So one area I think that could help for addressing youth mental health, I think we can all agree that there's been a shortage of mental health services and providers. One area or one means to address this concern to some extent is telehealth, the expansion of telehealth, which could increase access. And as you might know, during COVID, some of the restrictions around telehealth were loosened to provide this need that suddenly emerged. But we're still trying to, I think, synthesize the evidence to really show that telehealth is just as good as in-person care.
Okay.
And so I think that's one area where we could generate more synthesis around, or synthesize that research to demonstrate the efficacy or effectiveness of telehealth. And I think that's an area that could have policy implications, right, in terms of what kind of coverage there continues to be. So insurance coverage for telehealth once the, what is it called? They call it the public health emergency phase ends, which is, it's scheduled to currently in January of this year. And so that will have implications on what kind of telehealth services continue to be covered, I guess, federally, which of course then has trickle down effects to all the private insurers.